And I'm a hygienist. I graduated from hygiene school in 1991, and really, really long time ago. It's kind of hard to believe. And yeah, I've been doing coaching and development and speaking for about 20 years, a little bit more than 20 years. So that's me. I live in Charlotte, North Carolina. I have an awesome, supportive husband and two cool teenagers, and a boxer that's probably going to scratch to get in here in just a second. But yeah, so I've followed Mark and the group for a while and been to a couple of the events and been on the podcast. And I'm good friends with Parent Death Sports with Polaris. And I went to the scaling meeting back in November of 2022, and just sat down and started talking to Kay and Sydney, and that's kind of how this came to be. And so I've been just pleasantly, I mean, I can't say I was surprised, but just it's been pleasant to be part of the group, part of DSN. I felt, I think what you guys set out to do is create a positive environment is being achieved. I haven't seen any nastiness, which is unusual and really refreshing because, I really have a whole lot of time for that. And then also I worked for 9 years with Dr. Chris Bowman, who's also a part of the network, and he's an awesome, awesome guy, awesome dentist. He was an awesome boss. And so I always love to give him a shout out too.
Mm-hmm.
Yeah.
Oh, he is fantastic. I got to hang out with him a little bit at one of the Charlotte meetings, and I had seen him myself speak, and yeah, he's fantastic. I love his communication skills.
Oh my
I
gosh.
just, I think I told him at one point, I was like, I think I actually used some of your stuff, but I couldn't remember until you said it. And I was like, I think I totally just Chris Bowman somebody, patient. So
Yeah, and he really has a gift for that because he can just come up with analogies and things on the fly, and you're like, that really makes sense. Okay, I like that. So yeah, he's
yeah.
really great.
Yeah, for sure. Well, and I will say thank you for the compliment to DSN. Actually, the lovely woman who's with us, Ashley, is actually somebody who helps to keep kind of a really great positive atmosphere. She kind of keeps us all in line too. So Ashley, welcome back, of course. We're glad you're here as well.
Thanks, Summer. And thanks, Rachel. We're definitely excited to have you. And thanks again, yeah, for the shout out for
Yes.
DSN. That's exactly what we're trying to do, is create an environment for education and not
anything
other
other than
things.
positivity.
Yes.
Yeah. And I mean, it doesn't mean we have to agree on everything because there certainly
absolutely
are
not.
a lot of right ways to do things. There's not one right way. Yeah, so it doesn't mean we have to agree on everything, but we can disagree politely, I think. I think we can do that. Yeah.
I think for sure.
I think
Yeah.
social media is, we've kind of forgotten that.
Yeah. Yeah, we can absolutely do that. So thank you, Ashley, for your part in that. We appreciate it. So, well, I'm going to dive in and, kind of start with the topic that's really sticky right now for people. That's maybe it's not sticky, I should say painful for people. Is just that, right? We're all looking for more hygienists.
Yeah.
And I think the question that I get is, they've all been abducted by the aliens, or they've all, moved to a different position, but like, where is it even possible, or is it possible, Rachel, to find hygienists anymore that are purposeful and passionate about their career? And then how do you actually attract, those unicorns or whatever you want to call them? How do you attract them to your practice?
Yeah. So yes, I think it is possible. We're seeing our clients start to have more luck with that. I want to give another shout out, and I wish I had some statistics. I meant to do that today from this, but there's a really great report that I would encourage everybody to check out from Dental Post, and they do a state of the profession basically every year, and they just released one for 2023. So I think you can get that on the dentalpost.net website. And it really is pretty revealing around the hygienists that they had in their survey. I think they had like 15,000 dental professionals, and it's not just hygiene, it's all positions within the dental practice, about what their intentions are, team members of what percentage of people are looking for work. I think there's still or looking to change jobs. I think there's still a higher percentage than maybe most practice owners would want to hear. I want to say it was maybe around 30 to 40%. But I think it seems like the surveys showed that the hygienists are relatively content with the salaries they're making now, right? We know there was a big adjustment in that over the last couple years. And it seems like where they are now, there was, a level of contentment with that, which is good. And then I think we all know that even more important than compensation is practice culture. So I think that it is absolutely possible to find a hygienist that is purposeful and passionate about their career and what they do. And we have been doing a lot of reviews of hygiene ads for our clients over the last few months. And one of the things that I tell them is, I said, you have to attract them. So if you want someone that's purposeful and passionate, show them how you are purposeful and passionate in your practice.
Mhm.
So what we see a lot is, and it's not something that most dental practices do a lot, is write ads, right? And but there's some obvious things that we saw of using really valuable real estate to list all of the functions that any hygienist would expect to do, like take x-rays and do patient education. Like that's not, you can cover that once you're in the interview or you hire and you set your expectations, but really use that to highlight your practice. And most of the job listing platforms allow you to post links or photos or things like that. So either direct them to your social media. If your social media account is active and you are posting a lot of really great, photos with personalities and showing how you're giving back to the community. Are you doing a free dental day? Are you going out for a staff lunch? Are you, did you do a giveaway in the practice and you're celebrating the patient that won? Like all of those things are going to be attractive to a team member who wants to be in a dynamic dental practice.
Yes. Oh,
So
you're
it's
speaking my
just like
language.
anything else. You have to be what you want to attract, right? You can't expect somebody to come in and you're, kind of moping around and them to be energetic and change the vibe. You've got to set that tone.
Yep. Yep.
Absolutely.
Yeah. Which is funny because Ashley and I've done other webinars just based on that about hiring. Because I'm exactly the same way, Rachel, that I'm like, you will only get that which you are. And so, I say too, like your ads, I love the way you said that. Don't take up the valuable real estate listing the things that they already know.
Right.
For us, it really comes down to not even just what sets you apart so much as, you know, what would that person who is purposeful and passionate, what would resonate with them? And it's not going to be, we are a super fast paced, growing office looking
Yeah.
to add more hygienists.
Yeah.
So is everybody,
Right.
and so it's like, gosh, like, no, here's who we are. These are our core values. This is the mission that we're on, and this is what we're about. One thing that I did a while ago was I actually did a quick video
Yep.
of the people who were, my team members and my hygienists who have been with me forever. And I put that in the ad that they could click on that link and see why we're different.
Yeah. Yeah.
But
We
find
have
ways to set
recommended that a
yourself.
lot. Mhm.
Yeah, find ways to have hygienists that are purposeful, see other purposeful people in that practice. So I love that. You can still attract them, you can still find them. They're likely probably already in a job, it sounds
Yep.
like, but they may be looking. It sounds like 40% of dental professionals right now may be still looking. They're disengaged potentially where they're at. So um
Yes, we have recommended that a lot, to have team members do videos about what's great. And there may be things that you don't even think of that are really important to them. We had a client that they follow the Blatchford method, so their practice is closed for a week every 6 weeks.
hmm,
And that's huge. That's a lot of time off. And they do have the team come in, they rotate through, but still it's an attractive amount of time off, and they forgot to even mention it in their ad.
wow.
So it's things like that that you just kind of take for granted.
Mhm,
So ask your team, what's great about working here that maybe I don't think about?
mhm. That's a
Mhm.
great question. Yeah, because you're right. When it just becomes so ingrained in what you do, you forget that there's people who might be looking for exactly the culture that you've worked really hard to create.
That's right.
So let's say, you're starting to get some applicants. They're starting those little, unicorns, or I like to call them sphinxes. They start to kind of come out. They're starting to apply for the jobs, and you are seeing an experienced hygienist. This person's got 15 to 20 years.
Mhm.
I will tell you, sometimes doctors are like, yay, I'm so excited. Sometimes they have reservation because, right, it's like, gosh, we're a really progressive office. Are they going to be able to kind of jump in there, easily and learn new tricks? What's your feeling on that?
Yeah, so we see this all the time with the practices that we is, I would say they have probably 50-50 experienced hygienists versus newer grads, especially in the last couple of years. And we have seen hygienists that have been practicing for 40 years completely change the way they do things. So, yes, it's possible. Yes, it takes some work. And I don't think there's anything wrong with asking them right up front in the interview is saying, we are a progressive practice and we pride ourselves of continually learning. We embrace technology. We want to provide training and support for anyone who joins our team to really get on board. And we do have that expectation that everyone on our team is that we are continual learners. We take coaching, we give coaching, and it's all in an effort to really provide our patients with the very best care that we can. So, how do you feel about that?
Mhm.
And just stop talking and see what they say. I would say too is then really if they say, yes, I'm getting a little bored, I'm excited about learning something new, then it's your job as the team and the practice owner to give them that training and support. So we recommend that first week, just let them shadow the existing team members. You might be desperate for them to get in there, and they can help with things throughout the practice over the course of the week, but give them that opportunity to really kind of soak it in and to be in the operatory with the other hygienists, to be in the operatory with the assistants and to be with the business team to really learn your way of doing things. And it may not be for them, and it's better to find that out before they're like thrust into patient care. But it's going to really give them, let them know that you're willing to invest in them and invest in that training. So you kind of have to you have to walk your talk. If you're willing to train them, you've got to do it.
Well, and I want to touch base on a couple of things that you said that I think were really important. That was one, you set the expectation of who you are in the interview and set it right from the beginning. And then you close your mouth and you let them talk. And when they say something that might be contrary to who you are, you believe what they say. And I worry sometimes people hear that, but they're so desperate, and the one with the most need will always lose. So sometimes I think we're like, well, they didn't seem super enthusiastic, but I bet once they come in with us, they'll get excited. Believe them. If they're not super jazzed about things like that, believe them and just be okay potentially with not trying to put a round peg into a square hole. Not everybody's going to be right for you. And even when you're desperate for a hygienist, we can actually make things worse, I think. So that's one thing I want to say. Like, I love that you just said it so quickly, but I'm like, it's really important, set the expectations of what kind of office you are and the team of hygienists you're building right from the get-go, and then let them speak, and what they say, really make sure that you're listening to the answers and not just forcing what you want to hear. I think that's so important.
Yeah. It reminds me a lot of dating.
Yeah.
Right?
It's absolutely, I tell people that all the time.
It is.
Yeah.
Believe
And
them when they say it. Yeah.
It's a Maya Angelou quote too. I think Maya Angelou says that when someone shows you who they are, believe them. So that's exactly it.
Yeah, it's okay.
More of who they are, right, as they get comfortable. Like they're on their best, they're like on their best behavior.
Yes.
Give the best impression. So if the best impression is still not really wowing you, then maybe you should listen to that. And oh gosh, and then the other question I think you could ask is something like, so tell me a time in your professional life where you were faced with a change, maybe in philosophy, or, you were faced with an expectation and maybe it was a little scary at first, but you were able to embrace it and be successful. Like, tell me about that and see what they say.
Yeah. Put them into scenarios to see how they would respond is such a valuable thing. And my hiring team does that often, just puts them in the situation and says, tell me what you would do here. And again, really listen to the answers. And sometimes you have to unpack it a little bit with them. Tell me more about that. Tell me a little bit more about that. But then often, like you said, if they're on their best behavior and it's not wowing you, you have to decide, you're sure you want to potentially put that person in. So I think that was really valuable as we're looking for these purposeful, and passionate hygienists to interview well, set expectations well, set the ad well, just to make sure that you're actually putting out the bait. And then once you have them in the, you're doing the interview, really set those expectations ahead of time. The other thing that I don't want to pass too quick was, because I am the exact same way, Rachel, is on the onboarding, even with a hygienist and even with some experience, you got to slow down to speed up. Like often we want to just speed up. And I think that we can take these people who are so enthusiastic about our culture and we wow them. They're like, yes, I'm here. And we say, turning you loose, you got this, let's just sink or swim. And I think these people, we can unfortunately lose some really great people because we just overwhelm them. So sometimes to slow down, to speed up, I don't want to pass that by, because that was such a great point. I think it's so important with onboarding hygienists.
It is, and particularly, I listened to the session that you did with your hygienist Summer, and particularly when they're coming into a practice that is pretty dialed in. And, they have, our systems down, they have the handoff down, they're preparing and looking closely at the patients because they're looking at what else is in this patient's best interest today besides what's on the schedule. You offer adjuncts and lots of services. I mean, that's a lot. And there are a lot of, I'm going to say the majority of dental professionals are not coming from a practice that is at that level. Absolutely. I mean, just from what you see with, DSI and the percentage of where the dentists come in versus where they get to, it's a very small percentage of the dental world that's operating at that level. And we get so used to it because it's what we're around all the time. We think, well, this is the average dental practice, but it's not. So they're interviewing, if they're with your, members, they're interviewing with top tier dental practices, and they may have never worked in a practice like that before. And so it's important for them to get to see, when they're not under pressure, the things that are being offered to patients, not from a selling standpoint, but from a care standpoint, and to be able to hear another hygienist present that from, here's why this is important for you. Because if they're just thrown into an operatory and be like, okay, we offer adult fluoride to everybody and this and that, they're like, okay, how am I going to do all this? And man, you're throwing a lot at the patients. They're not getting the advantage of like the why.
Absolutely. And we agree, because I do think, right, that we've just been so dialed in for so long that it just all makes sense to us. So we've recognized that it's so overwhelming that we spend a really long time starting them off with just basic universal trainer. Our universal trainer isn't even a hygienist. She's just saying, hey, let me make sure you know where everything is, how to clock yourself in and out, how to use the software, how to, all those basics. We just start there with even our hygienists and our doctors, we do it. Because you're right, for so many who are listening to this, they're also those practices that potentially have things dialed in, or they're wanting to have systems dialed in. So I would say that's such a great point, is to really slow them down, to speed them up, give them that time. Even if you're paying them the wages and they're not producing, it's going to be time well spent if you do it well. Well, and along with that, one of the things we do in onboarding with our new hygienists is, we have, of course, a complete packet, but then we also have a lot of video series that they can watch to go through, in addition to time shadowing. But the thing that for us, and you're going to get into this as well, is we're really big on, hygienists truly don't sell anything. But what they do is they use what we have as 6 pillars of optimal care, that are up in all the operatories, that are up on our big screen TVs, that, our patients, our team from front office all the way back to the, dental assistants, everybody knows in our practice, these are the 6 things that for us mean optimal care. That's actually where we start hygienists. And then we just start to say what's all in those pillars, so that you can start having conversations and become like little investigators with your patients. Great thing is you're just never going to have to sell anything. The great news is you get to take a patient and they're going to be at some level of care right now, oral health care. They're going to be here. But as a hygienist, you get to be their tour guide to get them as close to optimal care as that patient wants. But don't forget, it becomes the patient's choice. You just get to be the tour guide along the way.
Yeah.
And that's really what we talk to our hygienists about during that onboarding time. And then they go listen to the hygienists about how are they using those resources
Yeah.
to just create impact with those patients. And I think you're really similar, that hygienists don't want to be told, sell more blank. They want to know how it's actually affecting their patients. But I'm going to let you kind of, go, you can kind of feel, I think, my conviction level on it, but I know you're really strong on that too. So kind of give us how you talk to them when, when you're onboarding new hygienists and you're talking to them about that optimal care. What does that look like for you?
So with us at Inspired Hygiene, when you say onboarding, for us, it's really like, how are we introducing these concepts as a coach
Mm-hmm.
to these hygienists that may or may not have had any say in whether or not the practice is working with us, right?
Mm-hmm.
So we do give our doctors some coaching and some scripts on like, how do you introduce us? Because we want it to be a positive experience from the beginning. And so I'll share some of that. And I think it translates well to practice owners is, I'm thinking probably every dentist that's watching this has done some type of, additional CE beyond what was required for their license renewal. And most have probably done a lot of additional clinical CE to bring new services and to expand services and really just take great care of the patient. So I think like creating that parallel with the hygienist is, look, I've spent a lot of time and money investing in myself and the services that I provide, and now I'm feeling like it's time to invest in the hygiene department and in you guys as well. And so here's where we've seen some areas where we could probably elevate our care and bring it more current, utilize our technology in a better way. And I really want to partner with you on that. And we'll take it slow. We're not going to jump into everything right away. But I think introducing them to the concept and saying this is going to be a collaboration. So, we're going to, because what we find is a lot of times the doctors are really nervous, but the hygienists are frustrated about the lack of systems, the lack of consistency, because they might treatment plan a patient one way and then the hygienist in the operatory next does it something different. And then the patient comes back to them and they're like, oh my gosh, we're not even on the same page here. So if we can get to the thing that's frustrating them and share with them that we can help them solve that, then it really gives them some hope.
Mm-hmm.
And they don't feel like this is happening to them. This is a collaborative effort to ultimately create better outcomes for our patients.
Mm-hmm.
And if there's ways that we can kind of pull it out of the hygienists, like we have some ways that we do that by sharing the AAP, like diagnostic standards of what is health versus disease, and then getting them to tell us, okay, so what percentage of your patients fall into each of these categories? And so if they're like, well, if we look at it that way, oh my gosh, like 50% of my patients, okay. So then let's work together to find a way to address that. And it's not going to be 50% of our patients aren't going to go into therapy right away, right? We're going to, we have sometimes some teams are raring to go to implement like the new verbal skills we teach them and new like protocols. And some need to step into it slowly again. And we say, you know what? Practice the inspired hygiene method with one patient in the morning and one patient in the afternoon and just really get it down. And then they start getting those positive responses from patients and they're like, okay, well, I have to do this with everybody.
Mm-hmm.
So I was kind of rambling now, but if you can
No,
make,
I love it. I love it.
yeah, kind of a, collaborative effort and help them discover where the opportunities for care may be. Like, what is it that you're frustrated with from a clinical standpoint?
Mm-hmm.
And what if we were able to come up with some solutions around that? And then also help them experience, the learning around the oral systemic link is a big one. And honestly, like there's so much evidence now. It's really, in my opinion, undeniable that there's a link. I mean, inflammation is the root of most diseases, right? And so there really is a link between periodontal disease and inflammation and lots of other, and also asymptomatic abscesses, like all kinds of dental inflammation and infection. So if we can really get our hygienists to believe, because they care about the patients. They know these patients. If you're like, think about Mr. Jones who just had a heart attack, and guess what? He has periodontal disease. What about this person that had a stroke? Guess what? They have periodontal disease. Like, we're seeing this in our chair, and it's really up to us. Like, we need to step into our role as healthcare providers is really what we coach.
And that's exactly what we say as well, is because perio, of course, is our number one pillar, more or less, of the six
Foundation. Yeah.
foundation. And so, we did the same thing. We kind of linked the oral systemic, which is undeniable. And I tell doctors, like, the research is everywhere. Pull some of that stuff, because believe it or not, you may have hygienists who really just don't know.
Right.
They may go home after work and they're not reading journals, and things like that. So pull the information. And then, exactly the same as you, the AAP, I lead doctors to all the time. And I say, there's so many good resources for classification that make it to where you can standardize perio protocols really simply. But it's important to get them all understanding those links, and then the verbiage to discuss with patients, because so often it feels scary to them. Because what I have found with hygienists is they say, well, I've been seeing them for this long and always just doing bloody prophies. Now what am I going to say?
Yep.
So I say, like, we're going to practice that now. We're going to practice it before the patient's ever in the chair. Let's talk about, what do we say?
Exactly.
So tell me, by the way, what do hygienists, how do doctors who might be listening to you right now, with your coaching, if you're in an office coaching a group of hygienists who give you that kind of excuse of like, well, you don't understand, Rachel, which I'm sure you don't understand.
Yes, I'm a hygienist. All of our coaches are hygienists, by the way, right? And we've all been in this position.
Right.
And I will say, I will share before the end a resource that we have, a couple resources that we have that can help with this a lot. So what we know is that, if a patient goes to their medical doctor and they have high blood pressure this time, like, the medical doctor's like, oh my gosh, they didn't have high blood pressure last time. Like, how am I going to tell them this? Like, stuff happens. Like, our bodies change and our health changes, and who knows what this patient's been doing the last 6 months, right? They may be super stressed out. They may be diabetic and they don't know it, or we don't know it. Like, there's a number of things that could be going on. So we just have to kind of take that we should have known this all along. But I get it, because they're looking at they know that, okay, this patient's been bleeding all of this time and I maybe haven't said anything. But go back and look at the notes, your clinical notes, and look at all the times you've talked to these patients about a power toothbrush, shortening their intervals between visits, floss, whatever it is. The hygienist has probably talked to the patient about this at some point, but maybe just didn't get to that point of recommending something different, some different kind of care, because maybe they didn't have those tools, right? They didn't have a clear perio protocol. So go back on that and say, look, I noticed that, your gums have been bleeding. This is not the first time I've noticed this. And we've talked about this and this and this. And you know what? I know you've worked on those things, but your body is not responding the way we had hoped, and it's time to do something different. So it's just, you're not going to get a different result by doing the same thing over and over again. So just look back, use that historic evidence, things that you've talked with the patient about, and just say, there's still active inflammation. We've tried all these things and tried to be extremely conservative, but it's time to do something different, because this chronic bleeding, is a sign of chronic inflammation, and it is going to increase your risk for this, this, and this. And you already have this and this and this. Mm-hmm. So I'm just really concerned about you. And so we're going to come up with a plan.
Yeah. Which is, most hygienists, I will say, when of course, everybody will say, oh, well, you make it sound so lovely. And I say, well, doctors, you can too, just practice that level of conviction and passion for truly caring for the patients.
Yep.
But I think that, most hygienists, if you would agree with me, they want to have this kind of impact on patients. This gives them a reason to come to work every day, because they're not just doing a 1110 every time. They're like, oh my gosh, I can link their heart attack or stroke to what I do, and I can help them get healthier. So it is pretty interesting when really, I think, hygienists understand it, practice it, are given a good system and resources, how many will start to make improvements and get excited about it. But with that being said, in your coaching, have you found, because sometimes I get doctors who will say, well, I feel like I've been doing that. I feel like I've been doing that. Mary's been with me forever. She's just not really going to change. The patients love her, but her perio percentage doesn't change.
Mhm.
Um, when do doctors potentially say this might be, I might need to say this hygienist is not meant to work here?
Yeah. Yeah. I would say, I mean, don't get me wrong. It is, I have employees as well in my business, and I get it. Like, it's hard to say goodbye to people that have been with you for a long time, have been loyal. Um, but you also have to look at, is this creating risk in your practice, not only for you, but for this hygienist and for the patient? And also, is it going to undermine the ability for the other team members to perform? And is it fair for them to be held to one standard and somebody else to be held at a different standard? Now, maybe one hygienist has a perio percentage of 28% and one has a perio percentage of 15%. Okay, like, let's do a little coaching, but like, it's not zero.
Mhm.
Like, everybody's not necessarily going to be at the exact same range. And I will say this too, and then remind me, I'll come back to like, how do we know maybe when it's time to let go? But one thing to pay attention to, and this is obvious, but sometimes we just forget it, is if you have implemented a new perio protocol or you're tightening up your perio protocol, those hygienists that have been in your practice for a long time have a very well established base of patients. And we do the same thing. Like, we practice those verbal skills, and we might say, okay, Mary, let's practice this one in the morning and one in the afternoon. Let's pick a patient that you think is very accepting to things that you recommend. Like, don't pick the hardest patient the first time, right? And then just do some coaching on that. But the other thing to be aware of is you need to insert some fresh patients into their schedule too. So if they're just recycling the same patients over and over, they're going to enroll a few and then they're going to hit a plateau. So you've got to kind of distribute these patients, like new patients, reactivated patients. You've got to distribute them as evenly as you can between the hygienists, or else you're going to have one schedule that may end up being just kind of stagnant just because it's the same patient over and over again. Does that
Mhm.
make sense?
Absolutely. Well, what's funny is depending on the perio percentage, if it was really low, so all of the hygienists you'll see a steady, incline in their perio rate once they understand this, regardless of their patient base. But then it does
Yeah.
get to a point where it's like,
Yes. It's a
okay,
plateau.
yeah,
Yeah.
it's going to have to plateau. And we've noticed that too.
Yes.
So I definitely think, that's something to watch for if you're comparing it. But when it's time to, let's say you've done that, you've tried to get the
Yeah.
resources, you've talked to them, you verbally talked through it, and Mary's just like, well, I'm doing my best. And as a doctor, when you walk in there, because all of our doctors, they're looking at the perio foundation as well as everything else,
Yep.
and you go in and you're like, shoot, this is not a 1110. I know
Yeah.
this is not a healthy mouth cleaning. What does that doctor do then? When is it time to, say it's time to move on? And you're,
So I'll say, this actually just happened to one of our coaches where, one of the hygienists had done like zero recommendations for scaling root planing. The other had done 40, quads of scaling root planing. And, all during the training, the hygienist is sitting there with the scowl on her face and just super, I mean, it was very obvious and super resistant. That is a blatant just disregard for the clinical protocol. So doctors, you are the clinical leaders of your practice. And it is your responsibility to, yes, create standards of care in collaboration with your team and say, this is where I want us to go. Based on these AAP standards, we should be recommending treatment at this level. Or you can say, we're going to start at this level. Like, let's say we're going to start at stage 2, 5 millimeters or deeper with bone loss and bleeding. And ultimately, we're going to work back to where we're treating disease at an even earlier stage. But let's start here where it's really clear. We can really get our verbal skills down. We feel very confident that this is the right thing for the patient now that we have this plan in place, and move forward together. So working with the team, accepting their feedback and their questions, like, I'm nervous about this. Okay, well, let's work through that. But when you've done that, and then there's a blatant just disregard for your clinical philosophy, it's not probably not going to get any better. And it's eventually going to undermine the other hygienists that are following and that are excited about what you're doing. They're only going to take that for so long, and they're just going to be like, I can't believe that I'm working this hard and I'm having these conversations and I'm having success, but then this person over here is not doing anything. And guess what? I end up getting those patients eventually. And then I've got to start this conversation from scratch, and they're wondering why this person didn't talk to them about it. So it creates a cultural issue within the practice. I think if there is somebody, then you really feel like, you know what, they are giving it their all. That's different than someone who is just defiant.
Mm-hmm. I agree. Yeah. And by the way, exactly what you said, I will tell you in practical experience is exactly what happens. Because always ask me how I know. I'm like, I can remember about 10 years ago, that's exactly what I did is I let one, Amy, who everybody knows, was just always trying to press herself a little harder, figure out things a little bit more. Yeah. And it's hard when the other hygienist who didn't really do as much would end up in her schedule. Amy would get really bummed because she'd get to be the messenger, that patient every time of bad news, it felt like. And she was like, I feel like the mean hygienist, So I think that's such an important, point that it undermines the clinical standards. It puts you at risk for malpractice things, which we all know. And it also just undermines you as a leader. I think when we have somebody doing that, people are watching. So I think you're right. When it's defiant, there's nobody, necessarily trying to change. It's becoming maybe a culture problem. It's time to reevaluate if this is actually making sense.
Yes, and I would say there are probably other things that are happening that are undermining the practice in addition to that, right? Maybe they're saying things under their breath, or they're rolling their eyes, or the doctor leaves and the patient says something, or there are things said in the community, like it's usually not that one thing. There's usually other things that are going on, unfortunately.
It's a symptom, and that's exactly what Dr. Casmel coaches, and absolutely.
Yeah. And it's funny. I'm like, I think Ashley and I have said, like, often, like, it's just the surface level, because I'm always like, when you can almost feel their eyes rolling in the back of their head behind you, I'm always like, doctors, like, oh
yeah, I know.
It's harmful for the whole team. So well, that was really fantastic. I loved that. I love the verbiage. I loved, how you said to coach them up, or lovingly try to figure out how to coach them out.
And and asking the ones that you feel like do want to get better, what can I do to support you? I mean, it's probably the same coaching that you're giving them, right? The classic, kind of like you said, like loving them up to the next level. What can I do to support you? Because I can tell you're really trying, maybe it's like, I'm just nervous. Okay, so let's work through that. And figuring out, are there pieces of evidence maybe that they're not utilizing that would help them be more confident and help their patients be more confident in that they're recommending. There's always ways to kind of tweak that. Yeah.
Mm-hmm. Yeah. Well, and that really does segue beautifully into that is the foundational piece, is discussing with them what optimal care looks like, starting at just the perio level, making sure they understand the link, the impact it has on patients, and they really feel committed to offering that optimal level of care. Because with that, then the question always becomes, well, often doctors are like, well, they're not at 3 to 3.3 times their pay, which, thanks to Jay Conway, I think everybody kind of knows is the standard. But I joke, like, it's a standard, but if we don't understand, like, sometimes we're shooting for the end result without understanding actually what to do and why it matters impact wise, because that number can be hit without focusing on it, but focusing on the process. Mm-hmm. And so, what I usually end up hearing is, well, I'm a PPO office, or, there's all these reasons why potentially my hygienist can't get there. Mm-hmm. And guys, here's what I'm going to say is, I don't know about you two, but they're not wrong in some situations.
Right.
Depending on the state you live in, what you have to pay, overtime laws, and PPO reimbursements. If you happen to be an office that right now you're having to take a lot of those, I do understand that you're not wrong, that it is a much more difficult thing. So I'll let you speak on that. But for say, some of the more traditional offices that take, some PPOs or some of the higher PPO reimbursements, it's totally doable, even with some of those higher wages, which I have extremely well-paid hygienists and they're able to do it. So I'll let you kind of discuss both sides of that, Rachel, what you've seen.
So I would refer them back to the webinar that you did with your hygienist. I'm not sure how long ago that was. I'm sure Ashley, you could put a link or draw people back to that somehow, because a lot of it was preparation. So, just knowing, I mean, that's a huge thing is I could never just walk in, 20 minutes before knowing I have a huddle in 10 minutes and feel prepared to really offer my patients the best that I had and the best that we had as a practice. I have to look at these patients and process like, okay, what's going on? What's going to help them today? What am I going to be looking out for that may or may not be the same as it was last time? And really, it's critical thinking really is what we're teaching, rather than a rote skill or memorizing verbal skills. It's really critical thinking of, now that I have these tools in my tool belt, what can I do for my patients? Now, that requires there to be things in addition to just non-surgical scaling and route planning, right? We've got to have some other things that they can offer. But okay, so the 3-to-1. So yes, I do think that it is absolutely being challenged with the increased wages and with cuts to reimbursement for sure. And I think that it is important to have a goal. Even if your ultimate goal is 3.3, you might say, you know what, right now we're at 2.5. And my goal for this year is we're going to get to 2.8. And there was actually a discussion in the forum on this, I want to say in the last week, about, well, you know what though, if you have a hygienist that is also really strong at co-diagnosis and teeing up treatment, and maybe they're in the community and they're talking to patients about your practice, and you get 5 patients a month from this particular hygienist, then their value is so much greater than that 2.8.
Mhm.
So yes, that is certainly something to strive for. I think it is a very worthy thing to strive for, and it is very doable, with a lot of planning and with the right standards of care and scheduling. I mean, there's so many things that go into that. But, there's a lot of value that they bring to the table in addition to that. And I think the DSM members get that. I think they're aware of that, or they wouldn't be in this group. But, it's not a bad thing maybe to track is, how much treatment is being teed up? How easy is it for me to walk in as the doctor? And it's all laid out there. They've already talked to it. The photos are up, the scan is there. And we tell our doctors, like, you just need to be the bobblehead.
Mhm.
You're going to get to a point where you're so aligned that they have everything teed up, and you're just going to be like, yep, that's exactly what I would recommend. And if not, you can say, I understand exactly, Ashley, why you would recommend that. And I'm seeing this one other thing, so I'm going to just tweak that treatment plan a little bit this way.
Mhm.
So
Absolutely.
there's a lot of
Well,
value in that.
oh, I couldn't agree more.
Yeah.
That makes my life so happy when,
Right.
when that
And it's
happens.
possible.
Yeah, it's totally possible. And what I say is, like, I think it's so important to know the numbers, know the hygiene numbers. And that's what I love about, like you said, at least doctors looking at that 3 to 3.3
Right.
times pay. It's good. And it's good for hygienists to understand. And
Yep.
most hygienists want to be valuable to their office.
Yeah.
They want that. So I think it is super important to know it, but at the same time, recognizing it's the process to get there. And sometimes, you can't compare one hygienist to the next, because I had the same thing written down as some of my favorite hygienists might not quite be right at 3.3, they're at 3. But boy, oh boy, do they present treatment. And
Yeah.
they're the ambassadors of sleep apnea, and they love to talk to patients about whatever. And I'm like, that's so valuable. You can walk into those operatories, and I joke that, you think about it, doctor, if they can take an exam for you and cut it down from 15 minutes to 6,
Yep.
How much is that time worth?
Right.
If you take that time, what's the dollar amount of me having a few extra minutes to go over to that next operatory, and right? Isn't it
Yeah.
almost similar? So
Yep.
sometimes there's metrics that are almost immeasurable that I think we have to recognize with hygienists, that their value is more than those numbers, but it's definitely something, like you said, to shoot for, because
Yeah.
it's important. And with that, I think a lot of times doctors then feel like, gosh, right now trying to incentivize my hygienists is hard. How do I incentivize them? Is there a smart way to do it? You know, I know how we do it, which I'm always like, it's a way, it's not the way.
Yep.
You know, so tell me, do you think incentivizations for hygienists are great? Do you think right now there's other things to do? Tell me kind of what your philosophy is.
Yeah, so our philosophy is yes, we feel like that if we're asking a lot of our team members, then there should be some outcome for them in addition to feeling like they put in a good day's work, right? And maybe that is, a higher wage than any other practice in town. Maybe that is little perks like extra time off or, fun lunches or things like that. I mean, you've got to find out what your team really values. And I agree with you that there are many ways to incentivize team members and hygienists in particular that work. And in every one of those ways, it didn't work in another practice, right? So it's just there's going to be pros and cons to every solution that's out there. I can't say that there's one way. But I will say that our most productive hygienist and client practices have some level of incentive in place. And typically, what it is once they hit that 3 to 1 or whatever the threshold is that's set, then there's a percentage of the overage that is shared with the hygienist. And so that is a really common one that seems to work well. Now, there are little loopholes of things in there, like clocking out when you don't have a hygienist, when you don't have a patient, and little weird things. So, what we recommend is have a written agreement that these are the rules of engagement for this way that we're working together. And it is, we still are a team. We support each other as a team. Our patients come first, and they are by far the most important. So if you don't have a patient, what can you do in the practice that's going to help support a patient? Whether that is follow up on treatment or seat a patient and anesthetize them, if they're here to see the doctor and they've been, doctor's running a little bit behind, like what can we do? There's no manipulating the schedule. There's no, you still have to do your notes. Like just have a really clear set of, agreements in place. And then also, again, that I hate to say it, but it kind of goes back to that defiant hygienist. If you have someone that is really willing to participate and grow and wants to be a part of the practice, they're going to be less likely to take advantage of that situation than the one that's already kind of bitter.
Mhm.
Yeah.
Yeah. And that's exactly what I have seen too, is, them just understanding the parameters of what makes sense, that we're a team, above all else, that we put the patient always first. And thankfully, by the way, our incentivization is exactly the same. It's exactly what you just said. And I have found it works really great. And the nice thing is there's no guesswork, because we have our hygienists, they actually calculate it themselves. So that they can actually see for themselves, okay, this is what I produce. This is what the overage is. It looks like it's about this. They turn it into our payroll person who kind of double checks it and is like, hey, congratulations. Awesome. That was another however much. So for us, it's worked really well, but I always say, like, really, it's a way. I don't want to gloss over though, because I want to make sure people did hear you say, you do have to find out what matters to the hygienist, because sometimes money can actually not motivate as much as people think. For many, they totally enjoy that kind of intrapreneurial type atmosphere. They enjoy it as hygienists. But for some of them, you are exactly right. Like mine, it was loops, one time, or being able to take advantage of, like Botox therapy that we have in our practice and stuff like that. Not to say any of mine done that, right? But sometimes maybe, but things like that. There's actually different incentivizations, time off, like you said,
Yeah.
having a house cleaner sent to their
Oh, I love that.
home. I've had actually a personal chef that just made a couple meals for their family because she was like, I'd love to do something more like that. I think really figuring out what actually is going to matter to them. It doesn't have to be monetary, but just recognizing that it's something that matters.
Yeah, that's actually a really good idea is, I mean, what if once a week you had somebody bring in a meal for every team member, right? They could take home and they don't have to fix dinner that night
Yeah.
or once a month or something.
Yeah.
That's a really nice perk. And I think that that could be, just say, hey, when we get to this level, there are some things that we're going to be able to do.
Mhm.
And we want to kind of meet everybody where they are. So you might have to mix it up a little bit.
Mhm.
But yeah, those things do tend to work. I had an example that just came to my mind of a client we worked with years and years ago, and great hygienist actually was very into patient care and was also really into, her bonus. And, they gave her the hygienist freedom to schedule the time that they wanted. But what we were like, well, she sure has seen a lot of patients. And then what we discovered was she hadn't written clinical notes in a week. So we had to kind of reset and be like, time out. Like you have to allow enough time for yourself you have to do this before the end of the day, or you're not going to qualify for your bonus.
Yeah.
So this is a non-negotiable. And so you got to slow down your patient pace a little bit because she would just keep packing patients into the schedule.
Wow.
And so we had to kind of slow that down a little bit and put some requirements there. In order to qualify for that bonus, you've got to observe they're the core values, right? Of things that we have to do to, A, be compliant, but B, also support, your mission and vision in the practice.
Absolutely. Yeah. Well, because that can also get you in some pretty hot water if you don't have those
Yes.
notes in there, for
Yes.
sure. Well, and your billing department gets real grumpy when they go back to look into the notes and they can't find them. But one
Right.
thing I want to kind of touch back on that you discussed was there's certain adjunctives that whether
Mhm.
you have a pretty solid PPO mix or you don't, it makes it so much more likely. And as you heard with Amy, we're huge proponents of giving them lots of tools in their tool belt to truly have maximum impact. But for us, it comes down to what are the tools they really will use? What are they excited about?
Yes.
And then I have to make it really accessible within their operatories. Because if I put it somewhere across the
Yes.
building, they're not going to get up to go get it. And I had to come to terms a long time ago with that I might have to invest a little bit more, but I also have to ensure that the, return on that investment will be had. So it's a delicate balance, but I'll let you kind of speak into when it comes to adjunctives, where do practices start if, and some of them listening right now have already implemented tons of them. So what are more of the
Mhm.
simplistic ones and the more advanced ones?
I mean, the simple ones are, and I would say with any adjunct, start one at a time, right? Don't like pick five and expect everybody to put them all in place at one time. Pick one at a time and first start with, okay, what is the purpose of this? Why are we doing this? And, get some education from the company, do some research, make sure you all believe in the science behind it and how it is going to benefit the patient. So, what is this going to do for our patients first and foremost? And then really get a read on the team members' buy-in. Like, what are they on board with this? Are they excited about it? Are they feeling like, yeah, I don't know, I think this is a little bit over the top, whatever it is. You've got to get that belief system in place before it's really going to take off in the practice.
Absolutely.
And maybe it doesn't have to be, again, equal playing field across everybody, but everybody's got to at least be willing to give it a shot. Because if you've got one advocate, they're likely going to see some results and then they're going to share those results with the other team members. And it's like, oh, okay, well, that patient got a really great result. That makes me think of this person, Mr. Jones. Okay, I'm going to present that next time, he comes in. So pick one at a time. I mean, the easy low hanging fruits are things like adult fluoride, or some other type of caries management system. Doesn't have to be fluoride. Um, we recommend, and I will just disclaimer too, like we have relationships with some of these companies, but even power brushes like the Sonicare honestly can make a huge difference. with, a patient that has periodontal disease combined with something like a chlorine dioxide rinse. We don't teach chlorhexidine any longer. Actually, we haven't for a very long time, but there are multiple types of rinses. The closest rinses, Oracare, Stella Life, Perio Sciences, there are multiples of them that are great adjuncts and work actually really well with a power brush or power flosser. We also recommend Perio Protect. We've had great experience with that personally as clinicians, and also our clients do as well. And that is something that we have seen work really well. Some practices are really believe in laser therapy. And so if they do, we're like, great, like you've had great, I think we have to pay attention to the research, the clinical science that's out there with research, but also our anecdotal results do bring value. And so don't discount all of that, and some, I find that doctors are really on a spectrum of, I need to see a couple studies on this and just hear from some colleagues, like, how is this going? And then we're going to test it out. We're going to test this out and see how it works with our patients. To others that are like, I have to see 5 clinical trials that are completely independent studies that the company had nothing to do with. And those are hard to find, to be quite honest. But there's a lot of things and one thing that I'm just learning about, we don't have any relationship with this company at this point, but is there's some new regenerative products. I think there's one called Curadont that's from Vivardis that is really interesting. And it's being used, it's here, it's in place, and most of the distributors are selling it now, but it's something that hygienists can even place that actually can remineralize, like regrow enamel.
Huh.
Yeah.
What's the name of that again?
It's called Curadont, I believe is the product name. The company is called Vivardis. And I've just been on a couple webinars about it, and I haven't tested it out yet. I haven't gotten my hands on it yet, but it seems very promising and something to at least investigate. And it could be a hygiene procedure. So now, of course, you want to check your state practice acts, but it doesn't require prepping or anything like that. It's applied kind of like fluoride. But I would say just allow your team, your dental assistants to practice at the maximum of their scope of practice, based on their licensing and your state requirements, because that's where they're going to really feel challenged and engaged and excited, is like, okay, like here's a whole nother level for me here. And I think in auxiliary world, I mean, because I'm a hygienist, it's very easy to see the ceiling, right? It is very easy. It's not that high if we look at the traditional way of practicing. But if we look at being proactive, if we look at like using, digital scanning technology and talking to patients about aligners, or even just talking to them about the restorative or their perio using scans, looking at some of these, guided biofilm therapy, like implant maintenance, there's a ton of technology out there now. It's just a matter of figuring out what is the best thing for your practice right now, and just being focused on one thing and implementing it really well.
Absolutely. And that's what I would say too, is there really is no short of almost of adjunctives and places that you can go.
Yep.
And that's what I keep finding, is the more I dig as to what kind of hygienists do. And in the state of Colorado, I'm fortunate, but I find that it just can continue to go on and on and on. So lasers, in-office little 20-minute whitening things that they can do. Of course, different kinds of guards potential, if that's something that you believe in. We have health scans pretty darn often, just to be able to talk about bite occlusion and how it relates to perio. And I agree with you. There's so many adjunctives that you can start adding, but don't add them all at one time. Pick the one that's going to have the maximum impact that you guys believe and can stack hands on, and just start there. And maybe take it for a quarter before 3 months before you kind of move on.
Yes, I would agree.
So, well, and I just want to finish it up, and we'll kind of wrap up quickly, but how much time do you recommend, right? When you're starting to talk to these hygienists, you're really starting to talk to them about these optimal care pillars, especially the perio pillar, adjunctives.
Yeah.
You know that the quintessential answer is, I just don't have time. And honestly, for some of them, they really don't feel like they do have time. It's not an excuse. So what would you recommend for how doctors can talk to them about time, and what time parameters do you give them?
Yeah, so I would say we are pretty much in the camp of if a hygienist is working alone without an assistant, typically 60 minutes. I think 50 minutes can work, but we typically recommend 60 minutes for, adult prophy perio maintenance, and then longer for a new patient if the patient is expecting to have some type of hygiene procedure done during that visit. That being said, I do think that assisted hygiene can be done very well. I think it can be done very elegantly and the patient to get a lot out of it, because the patient is still in the chair for that same amount of time or maybe even longer. They just happen to be working with two providers just like they do in a dental chair, right? So it's not that different. And there's a lot that hygienists and assistants can do together. What I would say is if there are time management issues, and we have some resources for that, is to look at the scaling. Because scaling is one of those things, like you may have heard of Parkinson's law, where the task expands to fit the time that's allowed. Scaling is one of those things with hygienists, right? Like we came out of school where if there's one speck of stain left, you're failing. Well, we have to look at like this is the real world. And Chris Bowman told me one day, he's like, look, I've never seen a stain emergency. Now, a patient might have a periapical abscess or they might have a tooth that's going to break on them. And I would rather you spend the time talking to them about that than getting off every speck of stain. And so we have to, like, we're in the real world now. So I would say looking at scaling and, is your scaling and polish time taking much more than 20 minutes of that hygiene visit time, however long it is? Because really, if it is taking much longer than that, that patient probably needs something other than a prophy.
Yeah.
Yeah. So
Yeah.
that's the first thing to look at. Or, okay, so what tools, you have the ultrasonics, are they in good working order? What tools do you need to be able to streamline that scaling process? And sometimes those are tough things to overcome because sometimes there are hygienists that still feel like they've got to touch every tooth with the hand instrument, even after going through thoroughly with the ultrasonic. So we do some ultrasonic hands-on instruction as well, and that can really help.
Absolutely.
Yeah.
It's such a hand saver. Sometimes they're just so
Yeah.
used to what they know. They
Right.
just do what they know.
Right.
So,
Right.
well, gosh, I'm like, I feel like we probably need a part two because I think I could probably come up with a whole nother list of stuff to talk to you about. So
Do
we'll have
it.
to get that scheduled for
Okay.
sure. But for right now, you're going to post some resources. I'll post some resources on this. I know Ashley has some stuff she'll continue to post because this is a huge topic for doctors, especially right now. But if people want to get a hold of you, first of all, can you just tell, if they're looking to get their hygienist trained, where do they go?
Yeah, so you can check us out at inspiredhygiene.com, and you can reach us there. You can email me at rachel@inspiredhygiene.com. And also right now, actually it's January 26th, 2023. We are launching today our completely revamped, rebranded Perio Protocol online boot camp. So this is actually a critical piece that all of our private coaching clients go through before their coach ever shows up in the practice. So it's kind of that foundational learning that's all virtual. It's a self-paced online boot camp, all about how to develop your own perio protocol. So we talk about time management, we talk about adjuncts, we talk about treatment sequencing and diagnosis and calibrating the team. And so that's available at periobootcamp.com. And that is going to be available until February the 2nd. We'll have that cart open. And DSN members do get a special courtesy on that. It's all caps DSN 400. So you get $400 off of the boot camp. And then Ashley, we could talk about if there's interest or you think it's worth it. The cart for this program for everybody else is only open for a week. But if we feel like there's enough interest in this with DSN members, then we can find a way to keep it open longer for DSN members, or maybe open it up a little bit more frequently, something like that to make it a little bit, special and more accessible there.
Fantastic.
And then I would say too, one free resource that I would offer is our standard of care worksheet. So if you want to sit down and say, okay, let's establish a really clear common standard of care, of when we see this, we're going to treat the patient like this. You can go to inspiredhygiene.com/standard of care and download that. It's a great starter worksheet to start those conversations and kind of help you facilitate that.
Yeah. Oh, that's
Awesome.
awesome. Yeah, that's such good stuff. I can't wait to send people to you, to your website, to this
Thank
boot
you.
camp. I'm like, that's going to be fantastic. I think that'll be so helpful. So, well, thank you both for your time. Thank you so much for hanging out. And like I said, I think we'll be definitely talking to you again here sooner than later because I could go on and on. So,
Sounds good. Let's do it. It was
um,
fun. Thank you
um,
both.
yeah, thank you
Awesome.
guys. Thanks, Ash.
Thank you, ladies. Have a good night.
Good
Thank
night.
you. Bye-bye.
Bye.